back to Words of Paradise. I'm your host, Leon Idle, and it's got my attention. America's kind of a joke. Like, we got a lot of fat kids running around, right? A lot of kids just a little too big for their britches, and not in the sarcastic, snarky sense, like literal fat kids. Yeah, obesity, kind of a problem in America. You know, something we should get under control. It's an issue, whatnot. How do we get it under control, though? See, that's the question. Well, according to CBS, we consider drugs and surgery early for obesity in kids, new guidelines say. Waiting doesn't work. I don't even know where to begin here. Obviously, I'm going to begin by going through the article with you guys because I want to see what this has to say. Maybe this is just a snappy headline, but I'm already, by the headline alone, blown away. Like, yes, the left wing and the right wing have all been fighting. Like, the left wing, oh, you should cut up your kids for surgery. They say they want to be a girl when they're a boy, or vice versa. And the right wing is all like, oh, it's child abuse. Never cut up your kids. Like there's the war on that front of the trans stuff. But now we're talking about the same stuff, but for cellulite. So let's go through here and see what sort of wackadoodle news I have just stumbled upon. Children struggling with obesity should be evaluated and treated early and aggressively, including with medications for kids as young as 12 and surgery for those as young as 13. I like how it says aggressively, like just beat the fat out of your kids. It's not child abuse if you're beating the cellulite off their tum-tums. According to new guidelines released Monday, medications as young as 12 and surgery for those as young as 13. They want to take the needle and the knife to your kids' freaking love handles at 13 years old. Why can we not just be like, yo, Timmy, I'm going to stop buying you McDonald's. Here's some broccoli. Like, why do we need to jump to medication and surgery? That seems like a bit of a leap when normal diet and exercise has worked for years. This is clearly a new issue. Kids didn't exactly always have an obesity problem. It's just because of the lifestyle that the 21st century has granted us. I don't think that we should just be getting rid of the traditional way things have worked, which is don't gorge yourself and go play some basketball. Like, I'm a nerd, I'm a loser, I'm a gamer. I haven't played a whole lot of basketball since I was a wee tyke. But I'm still in at least fine shape, I guess, you know, because I just don't eat, you know, I don't gorge myself. I stopped getting McDonald's at 3 a.m. after I realized, oh man, I don't like what this is doing to my body. But I'm around my 30s, so 12 and 13-year-old kids for medicine and surgery? I can't take this seriously. The long-standing practice of watchful waiting, who's ever used that term, or delaying treatment to see whether children and teens outgrow or overcome obesity on their own only worsens the problem that affects more than 14.4 million young people in the U.S. Yeah, 14.4 million fatties out there need to get this stuff under control. I completely agree. But not with watchful waiting, but nor with medication or surgery. I've never even heard this term, watchful waiting. I've never seen a parent, now granted, maybe it is out there, I don't know, but I've never seen a parent be like, yeah, Charlie's a bit tubby, but we're going to see if he outgrows it. Like, no, maybe enroll him in soccer or taekwondo, I don't know, and stop, you know, cooking greasy, fatty food or buying, you know, Captain D's every night. Left untreated, obesity can lead to lifelong health problems, including high blood pressure, diabetes, and depression. I mean, yeah, this is all true. You know, all this can happen if you're obese, but I'm still trying to get past the whole cutting up your kid part if this happens. It's just, one of these things does not necessarily need to lead to the other. Waiting doesn't work, said Dr. Ilma Anelli, co-author of the first guidance on childhood obesity in 15 years from the American Academy of Pediatrics. What we see is a continuation of weight gain and the likelihood that they'll have obesity in adulthood. Yeah. Yes, if you just sit there, if you're a bad parent, and you just sit there, and you let your kid play God of War 33 while eating nothing but Twinkies, and you're like, he'll be fine, and then you sit there and chug a beer while watching the big game on Friday, like, yeah, that's a problem. No one is denying that that's a problem. Yes, that's going to lead to obesity. But again, so far, I'm still having trouble with where the taking a knife to your kid's tum-tum becomes the solution. Weighting doesn't work. No one ever said weighting works. That's why we have I don't know where it's like where you guys live. Where I lived, we were required to take, athletics classes in high school. We were required to take gym or weights or aerobics or whatever. I mean, I took aerobics. I took other things as well. I took aerobics. I was the token male in aerobics class, and you know what? It was actually a whole lot of fun for many, many reasons. I'm sure you can gather what I mean. But that being said, I've never heard someone say just watch and wait, because it's obvious waiting doesn't work. Like, there has to be motivation to get out there and be healthy and work out and participate in sports or participate in at least physical activity, if not sports. For the first time, this group's guidance sets age at which kids and teens should be offered medical treatments such as drugs and surgery, in addition to an intensive diet, exercise, and other behavior and lifestyle interventions, said Anelli, director of the Center for Family Weight and Nutrition at Nationwide Children's Hospital. No, it should not be in addition to intensive diet, exercise. Like, that should be it. Diet and exercise. That is all you need. Want to know how Hugh Jackman, I know Hugh Jackman is not a child, but let's bring this up. There was accusations recently of Hugh Jackman using steroids to get jacked for Wolverine. He's like, no, I just worked out a bunch and ate a ton of chicken. And you know what? I'm not saying that your 12-year-old boy needs to go that hard. He does not need to become a shredded little manlet. But what he does need to do is probably eat right and, actually participate in gym at school, and then maybe go outside. I've heard all these talks like, parents should limit video games. Video games are bad, this, that, and the other. No. Video games are not bad. Video games, movies, all this sort of stuff it's very good for not just kids, but people in general. There's nothing that humans love more than a good story or good emotional interaction. And you get that sort of stuff from video games and from movies. But if you're going to just only devote all your time to that, you are sacrificing a healthy body. I've sacrificed a bit of a healthy body. I shouldn't have. I was in much better shape, man. When I was in high school and I was running track, and I had abs. Like, it was amazing. I still loved video games. When I was in high school, what were some of the games that were out and about? Let's use Sonic 06 as an example. Man, when Sonic 06 came out, I was too young and dumb to know it was a bad game. I dedicated a lot of time to that game. That being said, I always went out and ran my laps and stuff first, because you know what? That was my reward for going out and staying in shape and getting better and wanting to get the medals on the track team. And only after I went out and did my laps did I then come inside, veg out, and play Sonic 06. Now, I have lost both love for Sonic 06 and lost the body I had when I was in high school, but that is neither here nor there. So, basically, all you need is an intensive diet and exercise. It doesn't even need to be necessarily intensive, depending on your level of fatness. But no drugs and surgery for 12 and 13-year-olds. In general, doctors should offer adolescents 12 and older who have obesity access to appropriate drugs, and teens 13 and older with severe obesity referrals for weight loss surgery. Those situations may vary. But here's the thing. If you get this weight loss surgery, this needs to come back to parenting, for one. If you're a parent, you need to make sure that your kid, first of all, shouldn't be in that position. Now, I get there are medical reasons. Some people just can't lose weight. I'm not talking about that. There's thyroid issues. That is a small minority. It does exist. They're excused from the situation. I'm talking about the normal majority of individuals. If you're a parent and you're letting your kid get like this, well, first of all, shame on you. I'm not going to go so far as to say you should be locked up or be considered child abuse. I think that's a bit extreme, but you're definitely not in the running for Parent of the Year. You're probably right there above Darth Vader. And he murdered his son's mom, so, take that for what you will. The guidelines aim to reset the inaccurate view of obesity as a personal problem, maybe a failure of a person's diligence. It is. In 99% of cases, it is absolutely a personal problem and a failure of your own diligence. That is absolutely what it is. Children need to learn personal responsibility just as much as adults do. And to take away personal responsibility from both the child and the parent, that is... I can't believe we're even having this discussion. Now, am I a doctor? No, not at all. In fact, I'm terrified of medical stuff. I have white coat syndrome. I go to the doctors. I cry just sitting in the waiting room because I'm a bit of a bitch. But my point is, we can at least all acknowledge that personal responsibility is a thing. Your child needs to learn personal responsibility. You as a parent need to know personal responsibility. And if your kiddo's just sitting there playing Sonic the Hedgehog and eating Cheetos, and all of a sudden they go from, 110 to 180 over the course of, 6, 7, 8 months... yeah, you're both pretty much to blame. So getting rid of this whole stigma that it's a personal problem, maybe a failure of a person's diligence. It absolutely is. Shut up. Dr. Sandra Hasenick, medical director from the AAP Institute for Healthy Childhood Weight and co-author of the guidelines. This is no different than you have asthma and now we have an inhaler for you. It is different. You don't get asthma from sitting down and watching the Star Wars trilogy over and over with your bag of Lay's. That doesn't give you asthma. You're born with asthma. And yeah, there are some people, again, I get it, who are born just, their metabolism is not as good as other individuals. Their thyroid is not as good as other individuals. This isn't for them. I'm not talking to those people. Although I think those people should take extra care to go the step further to be able to maybe try and handle that without having to get drugs involved, without having to get surgery involved. You know, sorry you gotta work a little bit harder because God dealt you a shitty hand, but that's the lot you drew. Maybe you can go grow up to cure cancer and, you know, be vegan while doing it. I don't know. But yes, it is absolutely different than asthma. Young people who have a body mass index that meets or exceeds the 95th percentile for kids of the same age and gender are considered obese. Kids who reach and exceed the 120th percentile are considered to have severe obesity. BMI is a measure of body size based on calculation of height and weight. Thank you for that, 6th grade lesson. Obesity affects nearly 20% of kids and teens in the U.S. and about 42% of adults, according to the Center for Disease Control and Prevention. The group's guidance takes into consideration that obesity is a biological problem and that the condition is complex chronic disease. Oh my God. It is not a biological problem. It is for, again, a small minority of people. But this is not it. The majority of individuals, it is a lifestyle choice. It is bad decision making. It is lack of personal responsibility. It is that simple. It should not be treated as a complex chronic disease. You freaking lug nuts. Obesity is not a lifestyle problem. It's not a lifestyle disease, he said. It predominantly emerges from biological factors. Yeah, there are biological factors, but it's still a lifestyle problem. Because if you have said biological factors and you decide to live a lifestyle that does not keep those in check or counteract those, then that is a decision you are making. That's a choice you are making. This has got to be like from my generation, the participation trophy generation, that have now become doctors, so they're making excuses for these other little pigs. Oh, what a disgusting sentiment coming from these doctors. The guidelines come as new drug treatments for obesity in kids have emerged, including approval late last month of Wegovy, a weekly injection for use in children ages 12 and older. Different doses of the drug, called semaglutide, are also used under different names to treat diabetes. A recent study published in the New England Journal of Medicine found that Wegovy made by Novo Nordisk, I don't know where I got 2 in there, helped teens reduce their BMI by about 16% on average, better than the results in adults. Within days of the December 23rd authorization, pediatrician Dr. Claudia Fox had prescribed the drug for one of her patients, a 12-year-old girl. What it offers patients is the possibility of even having an almost normal body mass index, said Fox, also a weight management specialist at the University of Minnesota. It takes a whole different level of improvement. The drug affects how the pathways between the brain and the gut regulate energy, said Dr. Justin Ryder, an obesity researcher at Lurie Children's Hospital in Chicago. It works on how your brain and stomach communicate with one another and helps you feel more full than you would be. Okay, but how many of these individuals, and I don't know, I can only speak, anecdotally about myself. People eat when they're bored, they eat when they're full, they eat when they're not hungry. I know I've been guilty of it, we've all been guilty of it. That's what leads to weight gain, is when you decide to take the easy way out of, I'm bored, you walk to the fridge, open it, nothing in there, close it, go back, turn on Netflix, 10 minutes later, maybe I missed something, and you repeat that process till you find something you can shovel down your gullet. Like, sorry, that's why we get fatties that are, 12 years old, is because of poor impulse control, and parents not teaching kids about impulse control or boredom eating or anything to that effect. Are these drugs probably helpful? Could they work? Yeah, absolutely. But this is not what we should be jumping to. It shouldn't even be a question. This should be, in extreme cases, use this medicine. And in the most extreme cases, take a knife to Billy's tum-tum. And that should be it. Still, specific doses of semaglutide and other anti-obesity drugs have been hard to get because of recent shortages caused by manufacturing products and problems in high demand, spurred in part by celebrities on TikTok and other social media platforms boasting about enhanced weight loss. In addition, many insurers won't pay for the medication, which costs about $1,300 a month. I sent the prescription yesterday, Fox said. I'm not holding my breath that insurance will cover it. And frankly, they shouldn't. Don't get me wrong. I think the insurance system in America is garbage and needs completely overhauled. But no, insurance shouldn't cover you just being too lazy to get out and jog down the street. One expert in pediatric obesity, expert, I'm sure we'll find out, cautioned that while kids with obesity must be treated early and intensively, he worries that some doctors may turn too quickly to drugs or surgery. Never mind. You know what? I take the quotes back. You're an expert. I appreciate you. This is exactly what's going to happen. No different than how in the early 2000s, moms just decided to start throwing their kids on ADHD because they spoke too much. Kids ask questions. They're inquisitive. They're curious. They like to talk a lot. They like to experience the world. They're loud. They're rowdy. They're rambunctious. They've got energy levels. That does not mean they've got some sort of attention deficit disorder that you need to correct with medication, you insipid slags. So yeah, I'm in with this doctor. Yeah, if he thinks that people are going to jump too quickly using this medication and that should be cautioned against, good on you. You deserve the white coat that you have that, frankly, I'm still afraid of. It's not that I'm against the medication, said Dr. Robert Lustig, a longtime specialist in pediatric endocrinology at the University of California, San Francisco. I'm against the willy-nilly use of those medications without addressing the cause of the problem. Yeah, namely, too much God of War and not enough getting outside. Lustig said children must be evaluated individually to understand all the factors that contribute to obesity. He has long blamed too much sugar for the rise in obesity. He urges a sharp focus on diet, particularly ultra-processed foods that are high in sugar and low in fiber. Again, yeah, this is basic. I mean, I learned this stuff in like 4th grade health classes. You know, we probably watched videos that had like dancing sugar molecules be like, sugar bad, sugar bad. Like, I'm probably making that up off the top of my head, but tell me you didn't experience something similar in your 4th grade health class, assuming you went to a school that was publicly funded enough to actually have one. Dr. Stephanie Byron, a pediatrician at Cedars-Sinai Medical Center in Los Angeles, says she'd like more research about the drug's efficacy and a more diverse group of children about potential long-term effects before she begins prescribing it regularly. So, okay, we're getting some intelligent docs up in here, and I can appreciate that. I would like to see it used on a little more consistent basis, she said, and I would have to have that patient come in pretty frequently to be monitored if you are going to do this, because you do need testing. You need some test subjects. I agree with that. If you're going to use these, little babies as guinea pigs, at least go about it like this. Good job, Dr. Stephanie Byron. At the same time, she welcomed the group's new emphasis on prompt intensive treatment for obesity in kids. I definitely think this is a realization that diet and exercise is not going to do it for a number of teens who are struggling with this. Maybe the majority. Okay, never mind. You lost your credibility. You're an idiot, Stephanie. Look, diet and exercise will do it. It's like anything else. It's not going to be fixed in 2 weeks. It's a lifestyle choice you have to adopt that you need to stick to. It's one that I did for a long time, and then I stopped, and I'm kicking myself for every stopping. I used to be such an absolute gym rat, and now I'm not. Now I'm just a rat. And I need to get back to it. But more than anything else, kids need to get back to it. Not get back to it, get on it. Kids need to be taught so early about what good, healthy living can do for them. Does this mean they can never eat McDonald's again? No, not at all. After you've had a nice, successful basketball game or whatever, and you want to stop by Mickey D's, get yourself a Big Mac to celebrate, go for it. But you don't get to celebrate beating God of War on hardcore intensity difficulty mode without dying once by celebrating with a quarter pounder with cheese. No, you haven't earned it, fatty. Look, that's all I've got to say about this. Yeah, I was pretty intense, a lot more intense than the majority of my videos, and frankly, a lot of you are going to consider this offensive, but we are talking about cutting up children and putting them on medication because of some extra cellulite, when they could just drink their juice and go outside. Or is that not allowed anymore? I don't know. You let me know in the comments below what you think. Maybe I'm off base. Maybe there's something I'm missing here. I said enough times, not counting people with actual medical issues, but treating obesity like it's always a medical issue. Sorry, that don't fly with me, but I'm not a doctor. So someone tell me in the comments below what you think, whether you agree or disagree, or let me know on Twitter @BoltTheWord. And please do subscribe to the channel. I usually like to cover nerdy news, sometimes political stuff, but this one had to be addressed. So until next time, this has been Words of Paradise.